for coming. Happy International Women's Day.
Woo!
It's exciting. We're super excited to be hosting tonight's talk with Dr. Jenn Brix. Dr. Jenn is a local naturopathic doctor born and raised right here in Victoria, BC, with a bachelor's of science in biology and a certification in acupuncture, bone therapy, neural and injection therapy. She has over 15 years of experience. She's also the co-owner of the Brix Wellness Group and a founding partner of an early child care academy. In her spare time, she supports conservation and sustainability initiatives for wild elephants in Eastern Africa and animal trafficking in Ecuador. So pretty amazing life and background. We're thrilled to have you back again. So without further ado, if you guys can all help me welcome Dr. Jenn Brix.
Thank you.
Thanks for being here.
Thanks, everyone. And yeah, happy International Women's Day. And I'm also a mom. So I look back at all that travel that I did and that all the volunteering, and I just can't wait to get back to doing that. So hopefully in the next few years. But welcome, everyone. I'm so thrilled to be back. I practiced in Victoria for 8 years, and I met who is now my husband. We had a bit of a long-distance relationship. I moved to Kelowna, started practicing there, and told him if I move, we're going to move back as soon as we have a child. So that's what happened. We do still own our clinic in Kelowna and have our second location in Royal Oak. It's called Brix Wellness. So I don't work a lot. I'm mostly parenting, but I'm happy to provide some clinical pearls. I hope you'll get some tonight for yourselves, and of course we'll have, as long as needed, a Q&A session at the end for anyone who has any questions that they might have, or come up if you want to ask more personal things. So tonight we're going to talk about finding balance in your body. We're going to talk about everything women's hormones. So I see a broad range of ages in the group here, all women though, right? There's a few interesting tidbits for men, but I'm glad, well, I'm not glad, I'm sad to see no men, but we're really focusing on those important female hormones. We're going to talk a lot about the OAT axis. Anyone ever heard of the OAT axis or the OAT axis? Yes, okay, one person. It's kind of a newer axis. By axis, I mean a hormonal system in the body. So we're going to get into that, and again, talk about how you can really balance all the different components. Some may or may not apply to you, but hopefully you will find some clinical pearls. All right, so again, we're going to talk about hormones and what they are, what they do for our health, what some of the symptoms you could have if you have an imbalance, and how to determine what type of imbalance that is if you have some of these symptoms, because there's a lot of crossover, right? When we talk about thyroid or female hormones or even adrenal health, there's a lot of crossover. So we're going to talk about that OAT axis. OAT stands for ovarian, adrenal, thyroid. So it's the interaction between those three important glands and or endocrine organs, and of course once menopause hits and those ovaries are no longer functioning, that axis still exists, but it kind of shrinks down into the adrenal thyroid. So again, we want to talk about how to really support that, and we're going to talk about nutrients, herbs, lifestyle factors, lots of different things you can do to get your health back on track. So I'd love to see it. I'd like to have a little bit of interaction. It's so nice to be in person again. So does anyone, or do you guys want to raise your hand if you have a hormone issue? Are you here for yourself? Are you here because you have something going on? Or are you here just because you're curious? So some people, yes. Some people, is anyone here super healthy and they're just here because they have nothing better to do? No. You came for the entry into the draw. Okay, so yeah, we have lots of different symptoms that you'll experience when you have hormones that are out of balance. I know that the font is a little small. I'm not expecting you to read any of this. The quiz at the end is really easy, okay? So you don't have to focus. No, just joking. So basically, our endocrine system, we're talking about women tonight. We've got, it actually starts all in the brain. So you may have heard of the HPA axis. That's the hypothalamus pituitary. Those are both in the brain. Adrenal axis, right? The HPA axis. That's one that we hear a lot about. And there's lots of different things you can do to support that. But the OAT axis is one that's, again, newer, or at least new to us to focus on in terms of support. So it was actually, I guess, identified. I mean, it exists, but it was more identified by Dr. Michael Lum, who's a medical doctor, basically, who said if the adrenal glands are weak, there is often concurrent thyroid malfunction and menstrual cycle irregularity. Similarly, an underactive thyroid often makes adrenal fatigue worse off. And lastly, those who suffer from ovarian hormone imbalance symptoms, such as estrogen dominance, which could be anything from PMS to having blood clots in your menstrual blood, all the way up to just breast tenderness or irritability postmenopausally. But estrogen dominant symptoms often have pre-existing subclinical hypothyroidism exacerbated, right? So we look at estrogen dominance or issues with having too much estrogen in relation to our progesterone, high stress or history of high cortisol levels that may or may not have become exhausted, all the way down to low thyroid function, right? All right, so what are some of the symptoms that you might experience if you have an imbalance in the OAT axis? Well, everyone probably in this room has experienced stress, whether that's acute or chronic. We'll get into the differences between what that looks like in terms of cortisol levels, low energy, so whether that's just sort of subtle fatigue or tired when you wake up. You might get a really great sleep, or you think you get a great sleep, you're sleeping for 8-9 hours, and you still feel unrefreshed. That is a really key symptom to pay attention to, and that indicates possible adrenal fatigue or at least adrenal resistance. So difficulty coping, so you get that stress and you can't cope anymore. You get really irritable, or you react too quickly, or you just feel exhausted when things happen. Sleep issues, whether that's again falling asleep or staying asleep or not feeling rested when you wake up. Having headaches or migraines, often related more to that estrogen side of things, anxiety, depression, estrogen dominance we mentioned, hypothyroid or even hyperthyroidism. Infertility is a big one, PMS, weight management, typically that's going to be weight gain, and we see that usually around the midline. We call that the spare tire effect. Pretty bad perimenopause, this is also something, right? So again, really severe hot flashes and night sweats, vaginal dryness, irritability, list goes on. And then, if things are really pervasive, we look at heart disease and autoimmune conditions. So a lot of different symptoms and conditions that are influenced by that OAT axis. So we'll start out with each of those 3 components. So let's start with the ovaries. Does everyone, I guess maybe too much of a personal question, I was going to ask if everyone has their ovaries. But if you've gone through menopause, or if you were forced to go into menopause because you had a hysterectomy with your ovaries removed, then you are, again, not going to have potentially some of the symptoms that we see with ovarian health going on now. You might have other ones. But the ovaries are really important in producing our estrogen. We have 3 types of estrogen, 3 main types, I should say. Estradiol, estriol, and estrone. Really important for lots of different things, from our mood to pain management, to, of course, menstrual cycle, fertility, and breast health. But not all estrogen is good. In fact, estrogen has been considered our carcinogen. So even though it's something we make, it is classified as a carcinogen. There are different types of cancers that are estrogen receptor, contain estrogen receptors. So estrogen can bind to those receptors on those cancer cells and make that cancer grow, right? We are familiar with estrogen positive breast cancer, uterine cancer, endometrial cancer, and some of those others. So estrogen is not always good. We need to have a balance, and we also need to have the correct detoxification of estrogen. So when we talk about estrogen, it's really what does our body do with that estrogen? So again, not really going to test you on this, but here's our estradiol and our estrone and our estriol. Those are the 3 main what we call active estrogens. But in the liver, our body breaks these down into other byproducts. So we've got, to be really simple, I'm going to call these the 2s. So we've got 2 and 2. We've got the 16 and we've got the 4. And again, to be really simple, because it does go in order, the 2 is really healthy for us. That's what we want. That's what creates our femininity and all of the health that we need from estrogen. The 4 is going to contribute to things that are like estrogen dominant symptoms. So again, breast tenderness, you're going to get PMS, blood clots, worsening perimenopause symptoms. And then we have the 16, which can actually convert back and forth into estriol. But the 16 is more proliferative, and that is connected to a higher risk of cancer. So it's what your body does with your main estrogens here. I'm breaking them down. Do you guys know where they get broken down? Can you guess where that happens? The liver, right? So it's all, again, about what your liver is doing, liver function, how to keep your liver healthy. Now, you've heard of, I mentioned it already, but estrogen dominance. So this was an interesting finding. It was kind of like an animal study, I guess, inadvertently, that happened in Florida in Lake Apopka. So this was a lake that contained thousands and thousands of alligators. Any given night in the 80s, you could go out, on your boat with a flashlight. You could count several thousand, if you were out there that long, several thousand pairs of eyes. You could easily count thousands of these alligators. And it was about 10 or 15 years later that going and doing the exact same thing, they would, find maybe 100 or 150. What they found was that this lake was actually downstream from a chemical plant that produced a lot of xenoestrogens. So BPA is one that we know of. These xenoestrogens were actually filtering into the water, and they were converting the males to females. So the males were no longer fertile and were unable to, of course, procreate and have that population sustain itself. They actually found also that some pumas, like mountain lions who lived also in the area and sometimes would feed on gators or even the water, drink the water, we're also seeing these changes. So it was kind of like this big eye-opener, that there's a lot of things that were happening at that time, and Monsanto and a lot of those other big companies that were dumping byproducts, that was all started coming to light. But this one was really one that showcased estrogen dominance and what xenoestrogens can do. So in you, what are you going to feel? Again, I guess I'm repeating myself here. We talked about the signs and symptoms, but heavy or painful periods. A big sign for me when I ask my patients is, do you see clots in the blood? If you're looking, hopefully you are looking, you like to understand what's going on, but that's an indication potentially that you've got some estrogen dominance. If you've ever been diagnosed with a fibroid, or if you have a lot of pain, that can also be indicative of estrogen dominance, because fibroids grow from that estrogen. They're not a tumor, right? They're not cancer, but they are growing because that bad estrogen is feeding them. You also will see things like hair loss, breast tenderness, especially just before your period, slower metabolism, weight gain, brain fog, low libido, and mood swings. We see that connection with the OAT axis with thyroid dysfunction, so you might be diagnosed with a low functioning thyroid, migraines, endometriosis, uterine fibroids, and infertility. And it also happens in men, as I mentioned, with those alligators. So they get sort of more femtization, we call that, like man boobs, right? That's a typical gynecomastia, is elevations in not necessarily their total estrogen, but the way their body is metabolizing their estrogen. Now, you metabolize estrogen in two places, but in 3 different phases. So 2 of those phases are in the liver. So again, that's why we really focus on liver support. Phase 1 and phase 2, and then phase 3 actually occurs in your gut. So another thing to always check in on is your gut pretty healthy, right? Do you have daily bowel movements? Are they well formed? No mucus, no undigested, all those sorts of things that I ask my patients. Really to understand what your gut is doing, because that's where the 3rd phase of estrogen detox occurs. So the first thing you can do, we'll get into liver support, but just do an assessment at home, right? Just see, what are you exposed to, right? Do you have BPA in your life? If, this is important. Always avoid recycling codes 3 and 7, or if you see the letters PC or PVC on the bottom of plastic, right? The 3 and the 7 are usually within that triangle. Those are not good. Those are not things you want to be consuming food out of, or water or drinks. A lot of bottles are BPA free now, which is really good, but there's still a lot of other BPs, right? So bisphenol, probably X, Y, and Z, right, still exist that just have not been properly classified yet by Health Canada or, the FDA or whatever, to determine that it's unhealthy. So plastic in general is not a good idea. Obviously, don't ever microwave or heat plastics, styrofoam isn't really a thing anymore, hopefully. But again, those are all going to contribute. Heavy metals, so lead and mercury. Mercury, something to be mindful of if you really enjoy a lot of seafood, right? You want to be mindful of how much mercury you're getting. Phthalates and certain pesticides, so a lot of topical things as well. shampoos and cosmetic products. There's a dirty dozen. Now, again, you can't read this. This is from 2022 anyway. I just checked tonight, and 2023 is not out. It said it's coming in the next couple weeks. So the Environmental Working Group releases this every year, and it is the top dozen foods, fruits, and vegetables that have been sprayed with pesticides. So you're going to want to absolutely avoid those if you can. Now, there's always a little asterisk with that because we live on a beautiful island and we have a lot of local farms that maybe don't certify themselves as organic, and they're likely not using the kind of chemical spraying we're talking about. Really, this is about commercial products. But the dirty dozen, every year strawberries is pretty much top of the list, but last year was strawberries, spinach, kale, nectarines, apples, grapes. Those were the top 6. So you want to avoid those dirty dozen if you can and buy them organic, right? Or just trust where you're getting them. And then focus on the clean 15. So I always tell patients, don't spend that extra $1 for an organic avocado if you don't need to, because from a standpoint of pesticide exposure, there's really very little. They're not spraying those avocado trees. So last year, avocado was top cleanest food, sweet corn, not the same as your commercial corn, pineapple, onions, papaya, sweet peas, and asparagus. So those are the top 6, 7 clean products that, again, don't worry about spending the extra dollars on organic. So those are some things. Other things you may or may not be able to avoid. Again, I'm happy to talk to anyone personally, but things like birth control or even HRT is going to increase your exposure to estrogens, right? Potentially, or even synthetic progestins. So that's something to also consider that may be coming into your life for contraception or for other reasons. Or again, if you're postmenopausal, it's to manage symptoms. There are other ways. To work with that if you want to limit your hormone exposure. All right, so now what do you do for liver support? A lot of these things are probably fairly basic, but you may have forgotten that this is something you can do on a regular basis. But always start your day with a warm cup, or at least a room temperature cup of water with lemon. And my rule, or my sort of cheat, is to make a large pitcher of water, and I'll grab 2 or 3 organic lemons. I'll cut them up, and then I'll put them into the pitcher of water, and I just leave them in the fridge. And actually, those lemons I don't change up. I might do it every week or every week and a half. They start to get a little gnarly, but it's that breakdown that actually encourages the liver function. It's not the lemon juice; it's the bitterness in the peel and the pith. So I do that, and then every night I'll pour myself a glass of water, put it next to my bed, and then when I wake up, it's already at room temperature, and I just, guzzle it down. You don't want to be using it as a gargle or anything. I've got friends that are dentists that are always like, don't tell people to drink lemon water because it erodes your tooth enamel, which it can do. It's acidic. So you get it down, and then if you're concerned, just take a little bit of plain water, rinse and spit or swallow that, and you should be fine, not to worry about your tooth enamel. That's a great way. So that kind of gets the liver started, right? That gets the bile moving and gets the liver a little bit stimulated to start detoxifying through the day. Moving your body is really important. The lymphatics feed their deposits back into the liver, so moving is important to move your lymphatic system, avoiding harmful chemicals and plastics, and incorporating a lot of detoxification foods or superfoods. You want to look at about 1 pound or 2 a day. So things like cruciferous vegetables, broccoli, kale, cabbage. We'll talk a little bit thyroid health, and maybe you want to cook those if you have low thyroid, because they can impact thyroid, but those are going to be really important because of their sulfur-containing components. Turmeric or curcumin if you go supplements, apples, beets, artichokes, sea vegetables like seaweed, and garlic. And garlic you really want to do organic, I will say. I learned that from my herbal medicine teacher back in the a long time ago when I was in school. And basically she said, garlic is very detoxifying. It also absorbs a lot. So it's going to absorb what is in its surroundings. And when you have garlic in horrible soil, it's going to pick up and try to detoxify what is, it's bathing in. So organic garlic is really, really important. All right, so follow the dirty dozen, follow the clean 15. This is what everyone wants to always hear. Eat dark chocolate because it supports the blood vessels that feed the liver, and it has high levels of antioxidants. and then look at supplementation. So we're going to talk a little bit about supplements today. We're talking about, we're focusing on the Women's Sense line. So Ester Sense is one that I recommend for estrogen dominance. So this is a combination of supportive nutrients for phase 1 and phase 2 detox in the liver. This is not going to raise or lower your estrogen, right? We're not talking about you suppressing your production or stimulating it at all. We're talking about encouraging the breakdown of estrogen into the healthy metabolites that you want, the number 2. So you're going to find things like calcium D-glucarate really important, along with indole 3-carbinol to support with sulfur-containing components to help make glutathione and support phase 1 and phase 2. You've got antioxidants, green tea, turmeric for the liver, rosemary to help that conversion as well from phase 1 into phase 2, lycopene, sulforaphane, and milk thistle, right? So nice combination of, nutrients and herbal extracts to support proper liver detoxification. So it does have an NPN claim. NPN just means what Health Canada approves a product because of clinical evidence, human trials. So this has been clinically proven to promote healthy estrogen balance. And in doing so, it's going to help you with, again, if you're on this side of menopause, it's going to help you with your PMS and your and menstrual bleeding, and also symptoms of things like breast tenderness or irritability, but also post-perimenopausal to support that balance, and also to, again, lower your risks of certain things like cancer. It's fairly easy to take. It's 3 capsules a day. Just you can take it once a day. Best with food, but you don't have to take it with food. I've taken this product myself. And usually women like to wait a full cycle to see a change in cycles, so 3 weeks or 4 weeks, kind of minimum. Don't give up after the first week if you're still feeling irritated by, your husband or something like that. You can use this during puberty. You can use this in men. Again, it's really about helping support estrogen and its metabolism. Now, I wanted to bring this up because this is actually really new. It was just last year. There was another clinical trial using Ester Sense. I was actually one of the principal investigators on this study, and I actually was also one of the clients that did it. So what it was premenopausal women, just under 150 women that were involved in this clinical trial. We had to take Ester Sense for a portion of time, and then we also had to take a placebo, but we didn't know what we were taking which time. And basically, during that course of the study period, urine samples were taken, and the number 2 and the 4 and the 16 estrogens were looked at, and the ratio, and compared within people as well, within the person taking as well as across all 148 people, women, what the Ester Sense was doing to those estrogen metabolites. And what was found was that taking 3 per day led to markedly higher 2, so the urinary 2-hydroxyestrogen, the good one, compared to the 16, which is the bad. So it really helped create a healthy relationship or a ratio between those two. Again, with that ratio being a very clear risk factor for breast cancer. So we can't claim that this product, treats breast cancer or necessarily is something that will absolutely prevent it, but it will definitely improve that ratio of your 2 to 16 estrogen levels. So pretty great for something like a supplement to be honored in that way. All right, so the estrobolome is where phase 3 detox occurs. This is in your gut. So we've heard of the microbiome. This is the estrobolome. This is the collection of bacteria that metabolize estrogen. So they will do the third metabolism. And this is really important because if you do all that work in the liver, everything gets dumped back into the gut to be excreted. And if the bacteria reconvert them back into their active metabolites and you reabsorb that into your bloodstream, you're just recycling that horrible estrogen that you don't want to do. So suggesting or protecting the estrobolome and supporting it with probiotics and good fiber, eating fermented foods. There's so many things you can do for the gut, but I just don't want to forget that one piece that's really, really important when we talk about estrogen. All right, so that was our ovaries. I'm going to speak a little bit about PCOS just because it is important to address. I don't know if anyone here experiences symptoms of PCOS, but it is more common than we think. It is also related to estrogen dominance. So we found that estrogen dominance from endocrine disrupting chemicals, those xenoestrogens, impact hormone secretion and endometrial health and can both be involved in PCOS. So PCOS is polycystic ovarian syndrome. It is actually the most common cause of infertility due to lack of ovulating, so not having an ovulation. And it does affect a large percentage of women in Canada and in North America and around the world. Again, fertility is one of the main ones that it's impactful on, but it also creates a lot of pain and can cause issues with weight, and androgen levels can go up, which is your testosterone and male pattern hormones. So a lot of symptoms, but the typical ones would be gaining weight around the waist, getting facial hair, mustache, so male, again, testosterone related androgens that are going to be circulating. But it can lead to things like infertility, insulin resistance and diabetes, and heart disease. So it's really something to pay attention to. By definition, it's diagnosed through ultrasound because that's where you would see lots of cysts on the ovaries. So it's these cysts that are on the ovaries, and when that cyst erupts or breaks apart, it's can be very debilitating for women. So that's one thing. The second thing that occurs again is that elevation in testosterone, and then the third thing, of course, is that disruption of insulin and the blood sugar combination. So you see that rise in weight gain, and then that increased risk of things like diabetes. So there's a lot when we do treatment considerations. There's a lot that's involved. The basics, of course, there's also lots of allopathic treatments. Typically, spironolactone is common medication for that, and then there's oral contraceptives are almost always provided to women who are diagnosed with PCOS to kind of control periods, and then diabetes medications like things like metformin. On the other side of things, we look at again nutrient support, but the main nutrient that has been clinically proven to support all of those aspects of PCOS is something called inositol. Inositols are structured, basically nutrients that were once classified as vitamins. They're actually more connected to or related to a sugar molecule, and it is determined that we can make inositols, so they're no longer considered a vitamin. They're not essential to consume out of your diet. And there are two main inositols. I'll abbreviate them for ease, but they are called myo-inositol and D-chiroinositol, or MI and DCI. And they exist in our bodies at about a 40-to-1 ratio. So you have 40 times more MI circulating than you do DCI, and that's in healthy women. And when given that ratio, because they are individually important, so myo-inositol is more specific to the fertility and the egg quality, so egg health, ovarian health. The DCI is more specific to balancing the metabolic consequences or the blood sugar. So those two are really important in and of themselves, but together more important, because you will find you can get myo-inositol by itself and D-chiroinositol by itself, but you do need both of them if you're diagnosed with PCOS to help support all of the components that are going on. When taken in that ratio, we see reduced insulin resistance, reduced androgen levels, again testosterone, reduced cardiovascular risk, regulated menstrual cycle, and it is very important if you're going through an IVF situation. Gynecologists and obstetricians are all on board with taking inositols when you are undergoing IVF or in vitro fertilization treatments. Pregnancy rates go way up. So PCOS is a combination of the two inositols in that 40-to-1 ratio. You do have to have a powder when it comes to this, because you got to take a good scoop. Otherwise, you're looking at 5 to 10 pills a day, and it's just that's hard to be compliant with that. So PCOS is that in powder form. It also has some active B12 and active folate, so that if someone is taking it for fertility reason. It's also covering the basis if someone does get pregnant, but really keeping that egg or those eggs to come healthy so that conception can occur and the embryo can be maintained. So it's really easy to take. You just stir a scoop in water a couple times a day. There's nothing added to it. There's some organic rice hull powder. It's not flavored, which is why I really like this, because I'm kind of over all the stevia and all that kind of stuff. So it's really easy to take. But again, very, very specific to if you've had that diagnosis of PCOS. And if you haven't had the diagnosis of PCOS and you think you do have it, you can absolutely take PCO Sense. You can take this product to help to see if it will help you with the symptoms that you have. But if you have something else going on, it's probably not going to help. Again, that's where your diagnosis, going to your medical doctor or naturopath to test your testosterone, test your insulin resistance, and then potentially getting an ultrasound to see those cysts if they're there. All right, so let's move over to the adrenals. This should, because I see now there's a man in the audience, this should also cover you too, because everyone uses their adrenals on a daily basis, right? The adrenal glands are those little glands that sit on top of our kidneys. That's why they're called adrenal. They are the stress glands. They secrete cortisol. That's what we know them to do. But they're also really important. In men, they secrete all of the estrogen and progesterone that a guy needs. And in women, they produce the testosterone that we need. When we go through menopause and our ovaries cease to function, the adrenals actually are what pick up the slack to produce the estrogen and progesterone that we once were making from the ovaries. So adrenal health is pivotal if you are going through or will go through menopause, because if you don't support your adrenals, your menopausal symptoms and perimenopausal symptoms can be, or most likely will be, extreme or significant to you, because you need to have your nourished adrenals to pick up that slack and really care for those levels so you don't swing high and low. Before we get there, we want to support the cortisol production. And there are three areas or three main stages of stress that we all have likely gone through. So the alarm stage is when our bodies produce a lot of cortisol. So cortisol is not the same as adrenaline. When you're under stress, you produce adrenaline. Everyone knows what adrenaline is, right? You've had an adrenaline rush. That's very obvious. Cortisol actually is secreted by the adrenals about an hour or two later after that stress has occurred. So it's not the cortisol. You can't really say, oh, I'm so stressed out, my cortisol is so high. You know, that's like probably your adrenaline and some other neurotransmitters. Your cortisol actually goes up to help actually calm things down. Have you ever had a cortisone shot, or are you familiar with getting a cortisone shot injection right into an inflamed area like your knee, right, or in your back? A lot of people get that because cortisone suppresses that, right? It really brings inflammation down. It's a steroid hormone. So it's actually very important for adrenal function and to help you combat that stress. So in the alarm stage, your adrenaline will be high and your cortisol will be high a few hours later. That's going to happen. Now, if you're in the alarm stage every day or many times during the week, is that the freezer? Okay. It's not happy with me. All right. So when you have been in the alarm stage for days or weeks or months in a row, what do you think happens to your cortisol? You're pumping it out every time your adrenaline goes up. What do you think happens to that cortisol or your adrenals? They get tired, right? They're just like, I can't do it anymore, right? They're starting to falter. So what happens is you go into the resistance stage. That's where I would say if any of you have any symptoms of adrenal stuff, you're in this stage, most likely. Pretty much 99% of my patients are in this stage, because you will have days where you're really low and also days where you might be really high. And that all depends on, the function of what's going on that day and the stressor and your adrenal function. So in the adrenal state, in the resistance stage, your adrenals are getting tired. So some days they'll be able to pump out that cortisol, no problem. Other days they will not. And you will start to feel symptoms, which we'll get into. The exhaustion stage now is, again, maybe none of you have actually experienced this. The exhaustion stage is when your adrenals are basically tapping out. They can't cope anymore, and your cortisol levels drop, and they will essentially be flatlined. So you're going to have, that's where you can't get out of bed. You're going to have more chronic disease. People will experience things like chronic fatigue, fibromyalgia, things like that, where that cortisol you just cannot bring it up. So you can't cope with stress. And that's a more serious situation, and it's also very difficult to get out. It takes a lot more work to get out of the exhaustion stage than it does the resistance stage. So this is where, again, I see most of my patients coming in. These are like some of the main symptoms that you would see. So a sensation of feeling inflamed. You might have like sore, creakier joints or muscles. Mood stuff, so anxiety, irritability, depression, anywhere from mild to, sometimes severe. Severe would be maybe more the exhaustion phase. Sleep disturbances and fatigue, that's where I mentioned at the very beginning. If you don't feel rested when you wake up, that's because your adrenals are tired. They're in that resistance stage. Getting cold hands or feet, again, low back pain, arthritis, allergies, asthma, cravings. So cravings for salt, because salt is very important for the adrenals. The adrenal glands also control your blood pressure. So another sign, so dizziness, another sign of low adrenal or adrenal resistance is feeling lightheaded when you stand up from a lying down position. So if you stand up quickly, you get a bit of a head rush. Yes, you could be dehydrated, but it's also very common when you are battling adrenal fatigue or adrenal resistance. You'll also find cravings for sugar, because the pancreas is also involved, and prediabetes can coexist, and in coffee, right, you just want stimulants to kind of cope. You need something to get you going. So the dizziness, lightheadedness, feeling overwhelmed, getting more headaches, and then we see that weight gain right in the middle here, typically right in the spare tire, so this area here. Well, she was trying to say. So like, it's not necessarily, so, if it's lower or upper all over the body, we're looking at thyroid typically. If it's more central here, it could be PCOS, but more likely adrenal fatigue. So cortisol, again, you've gone through all the stages, right? So you've done alarm stage for a while. Your cortisol was really elevated. What does cortisol do? Cortisol calms things down, but also makes you gain weight. So high cortisol equals weight gain. Then when you go into the resistance stage, and you're having still some days of high cortisol and then other days of really low cortisol, your body thinks you're starving. When you go into low cortisol, your body wants to hold on to that weight. That's why this one is really hard to get rid of. So you could work out a couple times a day if you want, and you're gonna have this part being probably the most difficult to lose. And I see a lot of patients too that say, well, I'm working out all like 6-7 days a week, I'm doing CrossFit, I'm doing all this crazy stuff. I'm like, you're actually making things worse because you're putting your body under so much stress. That stress is the same as the stress that you feel when you have an exam or you have a deadline. That's still going to raise your cortisol by doing CrossFit. It is. It's stressful for your body. So you're going to keep that weight gain on, and it's going to go right here. Your body wants to store fat because it's high energy, right? As you can access that when you need that energy, your body thinks you're starving. It's also a really great place to store hormones, right? Cortisol and other hormones are fat soluble. They will get stored in that fat. Your body just wants those extra reserves because it does think you're really, something's really bad is going to happen and you're going to need that. So those are all those things that we see. And then of course hormone imbalances because of the OAT axis. Now I include this one because this was a patient of mine many years ago. I don't really do saliva testing anymore, but this is a saliva test that I did, and it just sort of shows the green, if you can tell, the green shaded area here is where your cortisol should be. So first thing in the morning when you wake up, your cortisol should be high so that you feel rested. You're like, I'm good to go. This is, I got this day. So your cortisol should be, around here, higher. This person's was very low. And then it should come down midday. If it drops too quickly, that's when you want to have a nap at 2 o'clock or after lunch. So it should come down, but not go all the way down here. And then it should kind of sort of settle out for before your bedtime, because if you've got too much cortisol before bed, it's going to suppress your melatonin. Melatonin is your sleep hormone, so you need to have moderate levels at bedtime. Too high is bad, but too low is also bad, because too low of cortisol will not activate your REM sleep. And your REM sleep is when you do a lot of the repair and a lot of liver detoxification. We're going all the way back to now the phase 1 and phase 2 for estrogen. So in this case, this patient, had severe well, it was sleep that was the issue mainly, and low energy. So a 57-year-old female, but it was pretty much flatlined. So in other words, she was going into that exhaustion stage, right? She was not able, she's got a little bit of a curve. So there is a bit of a change, but it really is, so you don't want to leave that untreated, essentially. It's also been shown that the Whitehall study showed that people with a flat cortisol curve have a higher risk of cardiovascular disease. And again, we always associate high stress with high cortisol, with heart attacks, you know, like things like that, but actually that exhaustion stage is even a higher risk for things like that. So I included this. I've got the website again at the end as well, but there is a stress test you can do. This helps just to understand really what is going on at these different stages, because again, if you can get tested for this. Again, I do salivary testing. I do that in conjunction with urine sampling now, but really to understand your cortisol, you need to know what it's doing throughout the day. You can't just do a snapshot of your cortisol. You should really see it first thing in the morning, throughout the day, and then before bed to see that curve. And if you don't want to do that, or you can't do that, because again, you have to go through a private functional medical doctor or naturopath to do that. These tests are not, free. I wish they were, but they're, a couple $100. So you have to shell that out if you want to kind of get that information. So this is one way to kind of see what might be going on for you. This is a questionnaire. Again, I have it at the end, so you can write that down. But generally, if you're in any of those stages, you still want to nourish the adrenal glands. And the ways to do that would be through obviously wholesome nutrition. I don't have to repeat this, but everything whole food is really important. Nutrient dense, protein rich. The protein general rule is 1 gram of protein for every kilogram of your body weight per day. So for anyone taking notes, say you are 150 pounds, divide that by 2.2, that's about 75 kilos or somewhere around there. So 75 grams of protein is what you would want to consume per day as a minimum. So take your weight and assess that, kind of see what you're doing. You can find tons of different protein charts online, foods that contain protein, how much, and then figure that out. Obviously, physical movement and relaxation, a combination of the two, work on your sleep. Understand how perception plays a role. There was a really interesting study that looked at people who, how they perceived stress. So a lot of people have a lot of stress in their lives and they don't think they have stress, right? Because they're not perceiving it. They're still having cortisol do its thing. So it is still, dangerous to have that. But perception can also, positive perception can also be a good thing. Optimizing your nutrient intake, I included some there. So your vitamin B is really important. B5 is the main one, but a B complex is important. Vitamin D3, get your vitamin D3 levels checked. I really encourage it, especially this time of year. I think you guys have, Health Essentials has the little, the D tests. Do you guys still have those? Yeah, the $20 ones. Yeah, so I use those as well in the clinic. They're not as accurate, obviously, as a blood test, like a blood draw test, but they are really good to just sort of see if you're in the sufficiency zone or the insufficiency zone for vitamin D. This is the best time of year to do it because we're coming into summer, hopefully. You're coming off of a long winter, and that's when your vitamin D levels are probably going to be at their lowest. So it's a good way to see if you're already taking vitamin D. That's great. Check your levels though, because if you're insufficient, it means you were not taking enough over the winter, and you should probably consider supplementing all the way through the summer and, again, increasing your dose. Vitamin C is also really important, omega-3s and magnesium. But when we look really at the adrenals, we want to look at adaptogens. Adaptogens are herbs that support adrenal function. And again, as I mentioned, if you don't have the ability to check your cortisol levels, then look for an adaptogenic formula, because adaptogens work like a homeostatic balancer. If you've got high cortisol, adaptogens will bring it down, and if you've got low cortisol, adaptogens will bring it up. So everyone would be safe, no matter where you are on that spectrum, to take an adaptogenic formula. So this is one, Adrenasense, contains rhodiola, suma, Siberian ginseng, schizandra, and ashwagandha. So essentially will help support the adrenals no matter where you sit, to help with energy, fatigue, sleep, mood, overall well-being, right? And again, if you are going into menopause or think you will, this is also something to consider. So finally, the thyroid. This is one that is everywhere. Again, I don't know if anyone wants to say that, yes, they've been diagnosed with a thyroid condition, but it's very, very common and more common in women. 1 in 10 Canadians suffer from a thyroid condition, but even higher, I would say, suffer from subclinical hypothyroidism, meaning having the symptoms of low thyroid without having a classical diagnosis, right? Because you can still have the symptoms and be, it's a bell curve. So if you're over here, you're normal, which isn't optimal, right? We're talking, you want to be in the middle. And many women are undiagnosed. So thyroid is important for metabolism, for energy, for weight management, which is really, where it comes into action. Again, when we talk about testing, a lot of medical doctors will only look at TSH legally, or from their colleges, they can only test TSH through Life Labs unless you've had a condition before. TSH is called thyroid stimulating hormone. It's coming from the brain, though. It's a hormone that comes from your brain and stimulates your thyroid. It's not actually your thyroid hormone. So I hate it when TSH is the only thing that they're looking at. I want to look at your T4 and your T3, right? Those are the thyroid hormones. Those are going to give me an indication as to whether your thyroid hormones are at the level they should be. If you only get TSH, something to consider, to be mindful about, again, it's a little small here, but the normal range is actually not this exactly from Life Labs. If you're looking at the labs here, I think it's 0.55 and almost 5.5. Here it's saying 0.45 and 4.5. But for simplicity, that's the range of TSH. That's normal. Again, TSH is thyroid stimulating hormone. So it is a hormone that's stimulating your thyroid. What do you think if the level is high? What does that mean? If your TSH is really high, it means your brain is trying to stimulate your thyroid more, right? Because your thyroid is sluggish. So a high number is a low thyroid, and a low number is actually hyperactive thyroid. Most people with a thyroid condition are going to have high levels of TSH. Higher than 5, I guess. Higher than 5.5 from Life Labs. I like to see your number between 1 and 2. Okay, so that's a very happy medium. That's a very happy optimal level. So again, if you get your TSH level checked, and if you're over 2 or even over 3, then you want to look at supporting your thyroid. Because then as soon as you go over that, you're like onto medication. Synthroid is the main medication that's prescribed. Synthroid is only T4. T4 is one of 2 main thyroid hormones. It's actually the inactive hormone. It doesn't really do a whole lot in your body. We rely, on ourselves to convert T4 to the active T3. So if you have other things going on like stress, high cortisol or low cortisol or inflammation, you cannot convert your T4 to T3 very well. So Synthroid is not a great option for a lot of people because it's not going to give you that active hormone. I typically prescribe, so Indies in BC are, as you may know, can prescribe medications. So I do prescribe medications for thyroid if it's necessary. I typically look at doing desiccated thyroid, which is a blend of T3 and T4, so that you're going to get, and it's the correct metabolic balance that you'd find in our bodies. So I usually will prescribe that for patients who need it. Now, symptoms of low thyroid. Again, low energy, you'll see, like, look at all this crossover with adrenal function, right? So low energy, weight gain, cold intolerance, hair loss. Hair loss is a big one. So hair loss, a lot of women come in. It's usually, all over or a recession. It's not the breakage that I have. Or it's more like, losing a lot of hair and then it not coming back. This little baby hairs are not really coming back anymore. A lot of dryness, so dry skin, dry nails, cracking nails, constipation, so again, sluggish GI tract, you're not having regular bowel movements like you used to, low mood, and then it can also really, really impact fertility. So what to do for a low thyroid? I'm not talking about hyperthyroid today just because it's more uncommon and it's not so connected to the cortisol and the OAT axis. So if you have a low thyroid or subclinical low thyroid, then you want to, again, follow a healthy diet and lifestyle. This is where we talk about things that you just have to be a little bit more mindful of, though, because the thyroid is sensitive. The thyroid needs iodine, so I do suggest foods rich in iodine. I don't necessarily suggest iodine supplementation all the time, because there can actually, taking too much iodine can actually stimulate what's known as Hashimoto's. But foods that are rich in iodine, so sea vegetables, and avoiding GMO soy is really important, and limiting goitrogens. So as I mentioned earlier in the slide, I think that was for the estrogens, is that you might want to cook the cruciferous vegetables, so broccoli, kale, cabbage, cauliflower, turnip, etc. Those, when in raw form, they have things called goitrogens. Goitrogens contribute to goiter. Basically, that's thyroid. They can actually inactivate the conversion of the T4 to T3 and really impact the thyroid production of hormones. So you don't want to eat a lot of that. So if you're like juicing, or if you're doing smoothies every day with kale, raw kale, bad idea, right? Do some variety, put in some spinach or some chard or some other greens, because the cruciferous, the goitrogens in that kale can really, over time, impact thyroid health. That happened to me, and I just thought, oh, what's going on? And it was like, yeah, I've been, having a smoothie like for a year and a half with kale pretty much every day. So you can steam your kale if you want and put it in too, but cooking it does inactivate those goitrogens. Consuming healthy fats, reducing levels of dairy and gluten, really, really important. I know that's, everyone thinks, oh, naturopaths will tell you to get off gluten and dairy. Gluten, I see almost every time involved, because I also check thyroid antibodies, and the antibodies will cross-react with gluten. So if you have a lot of gluten in your diet, your thyroid antibodies that attack gluten will start to attack your thyroid. So that's one to definitely reduce. And in dairy, I just had a patient that did her food sensitivities. She's got low thyroid and infertility from that. We took the dairy out, and her antibodies basically went back to normal, and they were like 100 over their limit. So that was specific to dairy, because we did test it, but dairy and gluten are two good bets if you're not too sure. Managing stress, supporting your adrenals, and then avoiding toxins like fluoride and bromine. It's not as popular here, I don't think, but when I lived in Kelowna for 5 years, like everyone and their dog had a hot tub. Like hot tubs are like, everyone loves hot tubs there. So, and pools in the summer. And a lot of people are going away from chlorine and putting bromine in their hot tubs, because it's nicer on the skin, doesn't smell so bad, but it's really, really bad for your thyroid. So again, if you use bromine in your hot tub, or at all for any reason, or again, getting lots of fluoride in different places like toothpaste, it can really push out the iodine. It competes for the iodine, pushes the iodine out, and then you've got a thyroid hormone that's, again, inactive. All right, and then when we talk about supplements, so staying on the theme here, ThyroSense, this is a combination of nutrients to help with the thyroid hormone production. So again, this is for low thyroid, symptoms of low thyroid. It's going to help make the thyroid hormones, but also encourage the correct conversion from the T4 to the T3. You can take this with medication, so it does, you can safely take this if you're on Synthroid and you want to encourage T4 to T3 conversion. You might want to chat with if you have a naturopath or a medical doctor that is, familiar with things like this, just to let them know, because it may mean that you could reduce your dosage as well, medication. And so generally 2 to 4 capsules. Try to do that in the morning and then before, the afternoon, because thyroid function is really most functional or active in the earlier hours of the day. All right, so finally we'll get to perimenopause and menopause. Menopause is, by definition, when you have had no menstrual cycle for a year, but perimenopause can last 10 to 15 years before this happens. I'm pretty sure that's what I'm going through right now. Probably, things are changing as I'm approaching my mid-40s. It's definitely, not something that's maybe some women are really embrace it because they have had heavy periods and horrible periods, and it's kind of nice to have a break. But it can really, can change things in your femininity. So if this is something you're going through, you want to always be mindful of what the cause could be. Why are your symptoms this way? And the symptoms can vary, right, from women to women. But you want to understand your estrogen, progesterone, and testosterone. So ask your doctor if you can get those levels tested to understand. It could also be how your liver is functioning. Maybe you're enjoying your, a glass of wine every night. Maybe that's a little bit too much for your liver and your estrogens are being converted improperly, right? And so those are things to also keep in mind. The adrenals, as I feel like I've really hammered it in tonight, but the adrenals have to be functioning well to avoid a lot of those severe symptoms. So you want to make sure that that's also addressed. And then the thyroid, if that's also concomitant. All right. So in the cases for MenoSense, I generally recommend, in menopause, I recommend MenoSense, which is a combination of herbs that are going to support the hormones from a balancing perspective, very similar to AdrenaSense and the adaptogens. So again, they're not going to create major spikes in your estrogen or progesterone or testosterone, nor will they cause any kind of suppression, but they're really, sometimes they say it's like a nice hug for your hormones, right? Just helping them feel nourished and really helping, kind of bridge that gap that from the ovaries to the adrenals as you proceed through that. It does reduce hot flashes and night sweats, so it has a nice NPN claim on it again, so it is clinically proven to do that. And also other symptoms of menopause, typically we're talking mood stuff, like irritability, and that would be 2 capsules twice per day as well. Now, if you only experience symptoms during the daytime, then I say, well, you could just do 2 in the daytime and forget the nighttime ones. But if you do have those hot flashes, night sweats at night, then you do want to really keep those levels managed throughout that 24-hour period. All right, so coming to the end, this is sort of a summary. I think we've already, mentioned all of these things, just how to keep a healthy foundation as well for your hormones. So if you came here, again, because you had nothing better to do tonight, this is the stuff that you want to focus on if you're not already, so making sure you're getting good levels of exercise, eating well, addressing any sleep issues, managing your stress, and perception, and then looking at how you can support your body so that you can stave off some of these symptoms, but also avoid medications if that's your goal, to really have a very good quality of life throughout all of your years. I want to mention Ishura as well. So Ishura you'll see on many different brands in this store. So Ishura is that little symbol there with the pink flower. It's a not-for-profit lab testing facility in Burnaby. It's actually considered the world's best in contamination testing right here in BC. It's pretty amazing. So it does look, they test foods and supplements for all sorts of different things, about 800 different contaminants, including xenoestrogens, including things like glyphosate, GMOs. It's also testing for allergens and also to make sure that what you see on the label is actually in the bottle. So you can guarantee that when you see Ishura on the label, you're actually getting more than what it says. You're going to get a little bit, but there's always like at least 10% more in the actual product. I know for the probiotics that they look at, it's like almost double. The amount of probiotic manufacturer is like double the amount that you see on the label. But this is really important to be aware of just because it's starting to, well, in a positive way, take over. Because Ishura is really the only testing facility that's looking at things like GMOs. So I'm not here to throw anyone else under the bus, but basically when you see some of those other GMO project verified and things like that, they're not testing the product, right? The products are, it's a bit of a paper trail, so they're trusting that the people that are growing the foods have a certified organic non-GMO farm, which is true, but pollen drift can occur, right? Things can always contaminate. So this is the only real way to confirm is by actually testing to make sure that none of those markers are coming up in raw materials and final products and all that kind of stuff. And then for the purpose of today, not having hormone components or antibiotic residues and things like that. And as we close, I'll just mention a little bit more about Women's Sense, which was who helped bring this night together. And they are a line of natural health products designed to help women through all stages of life. They are a Canadian-owned company. They are exclusive to health food stores. They're not going to find this in drugstores and grocery stores. They're really meant to be suggested and recommended to you through the guidance of product advisors and people that are well-versed in supplements. And of course, they are Ishura certified. They're also affiliated with the Canadian Women's Foundation. So $5 from every bonus bottle goes to this foundation. Last year they were presented a check for $100,000 from Women's Sense, which is awesome. It is a Canadian-wide foundation, but I did look up the programs in Victoria specifically that they were helping fund. So they're involved in Immigrant Services, Society of BC, Victoria Native Friendship Center, Transition House, so the Women's Transition House outreach programs, Youth Warrior Program, the Victoria Native Friendship Center, and helping remove women out of this, or moving women into safety who are in the sex industry. So what it's really doing is just empowering women, girls, and gender diverse people to live safe, violent-free lives and have confident leadership skills as well. So really, really great cause that Women's Sense is proud to be a part of. And I'll take this time again to thank you all, and I'll take questions. And I understand I went 1.5 minutes over my hour, so if anyone needs to rush out, please do. I'm not offended. There is a draw. You should all have received a little draw thing that you can put in there. I think they're going to be drawing that tomorrow for a gift basket. But yes, I'll open it up to questions.
Do you find that the body can sometimes take one of these supplements for a long time and then the effect kind of wanes off, and they so do you recommend cycling at all, or?
Yeah, that's a great question. So the question was just, would you recommend cycling products to things like so I would say nothing that I recommended is going to make your body dependent on it though. So it's not like your body is getting used to it and then it's going to stop functioning if you did stop it or switch. But I like variety. I think it is important to switch up adaptogenic formulas specifically for like for the adrenals, because a lot of the time the formulas, they'll be different, and there's a lot of aspects to adrenal health, menopause health, estrogen dominance. So yeah, I think variety is the spice of life. So personally, I would say it is good to cycle on and off different products, but it's not necessary they have to take a break. And some women actually like to stay, like Thyrosense is a big one that if you're on medication, a lot of women will just stay on that, as long as they're on the medication, because they do well with it. Yeah. Yeah. Ooh, no, I don't have a book on this topic. Well, there's so many, but I feel like if I said, I'm thinking of like the Hormone Cure and some of the older ones. I haven't read. Does anyone else have any recommendations for hormonal health books specifically? I feel like I've just done so much school and I basically research for a living that I'm. Oh, that one. Yep. Yeah. Yep. Dr. Karen Jensen is a local ND here too, and Marita. Yep, both friends of mine.
The one before that I used tons.
Yeah. Yeah, that's a great one. Women's Health Matters. Do you want to just raise it up and? So Dr. Karen, I actually took over Karen's practice at Valentis many, many years ago. So Karen's a good friend of mine. She's not practicing anymore, but she sort of does similar things that I do in education. And I've read that book front to back. It's a good one. She's also very focused on brain health too. Yeah.
Would you recommend the Galveston diet by Marie Claire?
Yep, absolutely. There's lots of different diets out there too. It depends on what hormone condition you're looking to combat. Yeah. Food is really powerful, right? Like we talked a lot about supplements, but food is really powerful, especially if you're on the cusp of getting into any of these conditions, right? So you haven't been fully diagnosed. Yeah.
Can I just say, I find it overwhelming sometimes to go into a health food store or a vitamin shop and decide, okay, what do I need to get for me specifically this month? Because I have a cupboard full of all these different things. I mean, I have a naturopathic doctor as well, and I meet with her a couple times a year, and there's some basic ones that she says, I should have. But overall, what do you think is the most important one to focus on?
When it comes to hormones, or so the most important, I would say adrenal health, because stress is pervasive, and I think that is a root cause for most things. I mean, stress is involved in 90% of all diagnoses, right? So whether it's hormones or not, it's going to, so adrenal health. And, you know, adrenals, you're not going to feel it overnight. So that's sometimes frustrating for people. They take a product and they're not going to feel like amazing the next day or whatever. We were taught in school for every year of stress, you should do 1 month of adrenal support. So if you've had, you know, 30 years of stress, you need to be supplementing or doing something for adrenals for 30 months to really bring yourself back to where it was. So I think it's also, I'm very wellness and preventative focused too, so I talk a lot about that with my patients. And so again, balancing the adrenals and helping support them is really important for prevention. If you've got estrogen dominant symptoms, Estrosense is excellent and doesn't have to be taken necessarily long term. Like that study was only 3 months of taking that particular product, and it reversed those ratios, right? ThyroSense would be more long term, but if you focus on the adrenals as well, you're going to hopefully cut that out and again just focus on that. So, yeah. But there's many types of adrenal formulas as well, right? So. If you can, I mean, maybe you've already done this, but you can also reach out to your ND to get your levels tested, right, and see. I usually do Dutch testing now when it comes to hormones. So, yeah, it's shortened to Dutch, but if you look up Dutch testing or the Dutch Complete, that's the one that was also used in the clinical trial to look at everything. You get like a 25-page report. It's pretty intense. That's a urine and saliva. Yeah. Because it's looking at the metabolites. So it's not, you know, when your body uses, so when you metabolize something, you activate it, and then you metabolize it again to basically excrete it. So when you look at excretion, like byproducts out of the urine, you're looking at what you have been using. Whereas if you do a blood test, you're looking at everything. You're looking at the inactive form, the active form, the stuff that's binding to your receptors, stuff that's not. So you're really going to get from a blood test perspective, like a diagnosis of like, you are menopausal. You're not, you know, cycling anymore, or you're ovulating, right? It's going to tell you like big things. It's not going to say you've got estrogen dominance because your levels are unhealthy. So that's why you look at metabolites and look at that through. Urine is a lot easier than stool, so. Just say that, we do urine testing. Yeah.
I'm curious, is it possible for someone to have estrogen dominance and PCOS, or are those, yeah?
Yeah, so someone can have PCOS with estrogen dominance because the estrogen dominance can actually lead to some of the follicles being improperly functioning and creating that sort of that pain, and then it can contribute to some of the infertility stuff. And then there is a you know, a relationship between estrogen and testosterone as well. So when that's all thrown off, your testosterone can also be elevated.
I'm curious because in all of these dialogues that I've been privy to in the last few years, I keep thinking about my mom and witnessing her in my childhood going through perimenopause, and the absolute hell that it was for her. Like, my mom had a really hard time, and I guess I'm curious, in your opinion, if I guess I'm trying to anticipate what's going to happen to me when I'm not far away from being perimenopausal, and so I wonder if like what my mom experienced, if that's genetic, or like am I going to be predispositioned to what she experienced because she's my mom, or is it more environmental factors, or like I feel like my mom is a lady of the 80s and bless her whole heart, but she wasn't ever invested in naturopathic health or supplements and things like that, whereas I've been more forward with that for my health, so I guess
I would say it's definitely, I'm sure there's a bit of a genetic component. I can say the same with me. I remember my mom going through it. I remember it just being like walk on eggshells and just not a fun experience. But she had, you know, there's other parts of her that are not like me, so she, you know, I think it was a little bit more extreme from that, but I do feel hormonally, when I talked to her about what her cycle was like and her pregnancy with me compared to, and my pregnancy that I had, a lot of similarities. So I think that in addition to like being really mindful of how you feel and what's going on every day of your 28-day cycle, if that's what you have, is also looking into potentially getting some testing done, because it can definitely give you that idea of what your body is doing with the hormones. Again, not the level, because when you go through perimenopause, yeah, the level will go up and down, but what your body does with it is really important, because you can't get that information from your mom, but you can definitely see when that stuff's on paper, that connection between that symptom that she was having and what you might be having and your levels, it will become more clear, and then you have a target. So again, for someone that has a lot of supplements in their, cabinet, because everything seems like it's going to work for you, and there's always something that you can find. I'm sure you can resonate with every single product in here to some extent, but just understanding what is specific to you, because we are all individuals, and we all have our own story, we all go through our own things that all impact how our hormones function too, right? So I guess I'm a bit of a nerd. I did like biochemistry, so I'm really into testing. I really think it's important to have that kind of stuff. First and foremost is how you feel and your history and your symptoms, but second would be to kind of corroborate that with what I see on paper, because then I can have a clear way of treating you with the many things that I can, my toolbox, but really giving you the specific ones. So I think understanding, what your mom went through, and then looking at what is going on inside your body to see those imbalances that you can tweak before, a suboptimal becomes deficient. Yeah. Good luck. Yeah.
I was just wondering, on the AdrenaSense here for the formula, it says consult practitioner for use beyond 1 month.
All of those cautions are going to be based on Health Canada's regulations. So it's kind of slapped on every product for whatever reason. The easiest way to explain that is if you don't feel better after a month, then you should really check in with your doctor or whomever suggested to see if you're taking it right, or maybe you're missing something, or maybe there's like something underlying the issue. It's really, honestly, it's just a caution. So
Because it's fine to take, you were saying?
100%. Yeah, you could take it long term. If you have an adverse effect, though, obviously you want to stop it and reevaluate.
And can you take the thyroid sense along with the adrenal sense?
Yes. If you wanted to, you could take all of these products together.
Woo!
Yeah.
It's a nice cocktail for
Yeah.
hormones.
I'm not a fan of so many supplements, but yeah, you could definitely. Yeah.
Can you talk about hair loss? You said not
Yeah.
the breakage kind.
Yeah.
So talk about that.
With hormones or just in general,
Oh.
like hair loss? Well, the top two things for hair loss would be I would test for iron deficiency, and then thyroid, so low thyroid. So those would be the top two, probably cover 90% of the reasons why women would have that. It could be other things though related to other anemias, so it could be low B12, low folate, low vitamin C as well. But scurvy is not super common anymore, at least not deficiencies in vitamin C. And then also, the estrogen and progesterone relationship, and testosterone. So in women, the testosterone elevation that we would see in like PCOS, you're going to get the hair growth here, and then you're going to get the recession here. So you're going to get hair growth where you don't want it and lose it where you do. So I know there's a lot of different reasons why you could have that hair loss.
Because you said in the presentation, you said the overall hair loss as opposed to the breakage.
Totally.
So
Yeah.
what's the breakage?
So the breakage would be probably biotin deficiency, silica would really help. So it's more about the keratin and the collagen. So hair is connective tissue. You probably all are familiar with collagen and how big it is. So collagen is the main protein in your connective tissues. And so you're going to, if you don't have enough collagen from a protein standpoint, not getting enough protein to make it, you don't have enough vitamin C or lysine to make it, or you have things going on in your life that really eat it up, you're going to lose the collagen in the non-essential areas like the hair. We don't really need hair that much to survive. And so you're going to get more of that keratin and elastin collagen relationship being poor, and then you'll get the breakage. There's obviously lots of other things like topical stuff like heat. That's not great. Blow drying and straightening and all that stuff's not great for your hair. But yeah, looking at more nutrients versus like hormones. Yeah.
Could the AdrenaSense work for like inflammation with like eczema and like skin issues? Like, is that like an adrenal thing? Or like, could that be a hormone
That would
thing?
be, I usually look at foods for that first, and liver. Yeah. So a food sensitivity, not an allergy, but a sensitivity to something. So gut health. If we don't have a super, awesome gut, or our tight junctions are weak and you're getting leaky gut, then you're going to get more things going into your system, more things being detoxified, and your skin being the biggest detox organ you're going to start to see that stuff coming out. That's why you see it with, acne with hormones and fluctuations, because again, your body's not breaking it down well enough, or it's metabolizing into the bad ones, and then you're going to get breakouts or essentially increase in oils that feed the bacteria on your skin, blah, blah, blah. That's how acne works. So, but eczema, same thing. It's just generally like the detox organ of the skin is overwhelmed. Yeah, so I don't think Adrenal Sense would do much specific to that. Yeah.
So which supplement did you recommend for like the more hair?
If you've got too much of this hair and not enough of this hair, then you want to balance your androgens. So that can be a sign of PCOS. So the PCO Sense would be specific to help lower that androgen burden.
And what about acne with like adolescents?
Yeah, so that's, again, I would look at liver, so estrogens, because it's really the hormone imbalances that, again, are creating that increase in the sebum, which is like the oils in the skin. And then that creates an environment for the bacteria that live on our skin to go in and create the acne pustule, right? That's why antibiotics are given for acne, because it's essentially an overgrowth. So I also recommend fixing the gut, making sure that's healthy. Microbiome, will translate to healthy microbiome on your skin.
So
Yeah.
if somebody is taking contraceptives for the acne,
Yeah.
would it be advisable to take the estrogen?
You can still take estrogens. It's not going to make you have be infertile. In fact, not infertile, but create fertility if it's a woman, for example. It's actually very good, because you're going to break down those exogenous, essentially xenoestrogens or xenoprogestins. So it's going to help metabolize them properly, but it's not going to make it ineffective. So yeah, you could do that for sure. The only thing you want to caution with, obviously, is always if someone's on Accutane, because Accutane for acne is so hard on the liver, so you really have to avoid most things. Milk thistle is really safe and gentle, but most things that work with the liver, you just have to be really careful with. So I'd have to talk to you privately about what would be best for that. Again, please don't wait on behalf of everyone else. If you guys need to head out, feel free. I might just shut off the mic and then take more questions up here if there's any more. And happy shopping if you're staying around. And again, thank you so much for your time.